there. So India has two confirmed cases of the Omicron variant in Karnataka, but many more sampling of genome sequencing is awaited. The result of it is awaited, and in some time from now, we will know the real picture of the spread of the Omicron variant in the country. Joining me today is Dr. Arunesh Kumar. He's the head of the Department of Pulmonology at Paras Hospital. Doctor, if I can ask you, do you think India is prepared to tackle the Omicron variant, even though we know little about the variant at this particular time? But still, the large mutations is something which has gotten scientists, not just here in India, but across the world, worried.
Thank you, Ranjan. Good morning to you and your viewers. Well, yeah, I mean, I would say if you ask me, as compared to the second wave, are we better prepared? We are, because we know more about the virus now, because that at that time we didn't have much of an information on it. We also have got a population which is better vaccinated than it was at that time. We briefly know about the virus that it had changed. It had changed to an extent where 30% of its core or more has been mutated. So mutation generally doesn't happen for bad. Sometimes it can happen for good. And that's what we don't know. And that's why we have to watch this space, whether this mutation has happened for good or for bad. Now, what can happen for good? For good, it may happen that it may cause more asymptomatic or mildly symptomatic disease. Because with COVID, remember, we know that people get infected regardless of what mutant you are carrying. But we don't want a sicker patient, because sick patients are the ones, severe disease is the one we dread, because they will be one in our hospital. They will be overwhelming our services. So these are the ones we don't want. Certainly, I think we are better prepared. But let us hope we don't have to see the sheer number we saw in the second wave.
That really is the hope, and like you pointed out, Doctor, a good population in India is now vaccinated at least with one dose. Also, the sero surveys are suggesting that Indians have good antibodies through the way of infection or natural immunity or through vaccines, at least about 67% of the country. Do you think that's going to give us an edge, considering a large number of us were infected due to the Delta variant, at least in the second wave?
Definitely, that is an advantage, because post-infection immunity is very vital when it comes to any disease, and respect to the immunity you generate after the infection. Now, what we don't know is how much this immunity, be it your post-infection immunity or post-vaccination immunity, is going to talk to these viruses. Will we see more sort of immune escape phenomena with this? The early data from South Africa suggest that there are new infections in the people who already had infections before. So new reinfection is common in Omicron variant. These are early data, but it tells you that you can get reinfected. So there may be an immune escape phenomena. There's a higher chance. But good news is, so far we have not seen many sick patients in South Africa. So infection number is higher, but they are not sick enough. So certainly, I think in Indian perspective, we are better vaccinated. It will play a role, and hopefully, even if we see the high spike in the number of new infections, we may not see the severe cases, because with vaccine, we know that it does prevent the mortality in the severe disease and mortality. There is a definite advantage post-vaccination. Since our population, we are better off since March and April. So it should translate into less number of sicker patients and hospitalization.
Yeah, that really is the hope. And as far as vaccinations is concerned, now it's being reported that most of the people who are infected with the new Omicron strain, in fact, are vaccinated. So, is there any data per se that we have right now which suggests that vaccine immunity can be slashed to a few notches at least because of this new mutation?
Yeah. So not much so as yet, but see, reinfection data are there. and some of these patients were vaccinated. So breakthrough infection will be common. We should expect breakthrough infection. Breakthrough means you are vaccinated and still you are getting infection. That may be the case because with the mutation, one of the things that happens is immune escape, and we may be seeing that numbers. But then again, it's too early because I think in 2 weeks from now we will have more data regarding their admission numbers. Overall, wherever we have seen Omicron variant being found, their new infection rate has gone up for sure. So the number of people who are testing positive is higher, but they are not necessarily sicker. So that is something we need to watch out for. In the next couple of weeks, things will be more clearer.
What I also want to ask you, Doctor, is that we are saying that India is better prepared, A, because of our vaccination numbers, and also because of the sero survey results that are indicating that we have antibodies. So, what really will be India's biggest challenge to tackle the Omicron variant then?
So one will be that if we get we know that once this starts, number of new infections are going to be higher. So those patients who are not vaccinated, they all still remain a challenge because those who are unvaccinated are at a very high risk of not only catching the new infection but also the getting a severe disease. So that's the one, because we are not very completely vaccinated. Our numbers are not still very high. Second one will be because of a large population country, even if the milder ones, even if say 0.5% of it require hospitalization, if the virus changes its behavior where you start becoming sicker, then we can get overwhelmed with the numbers, because our 0.5% also will be a very huge number. Having said that, I mean, because of the lessons we learned from the second wave, we have got a better oxygen plants. Our hospital, for instance, has got oxygen plant. Most of the hospitals now are getting those supplies. So we have got a better drug availability, because that's the second thing we were caught off guard at that time. We didn't get even the medicines, simple whatever is required for the treatment. And also, I think people, the medical workforce, our staffs, they are also vaccinated at that time. Most of even medical staff were not vaccinated. There was a big fear going in that what if you go there and catch infection yourself, and there was a high mortality for the frontline workers. So this time, this on these grounds, certainly we are better off. And if the number of sick patients are not that high, we should be all right. We are able to handle the mild infections without any problem, and that's what happened. And some way it's better as well. Remember, those who are not vaccinated and get a mild infection, this infection gives you a vaccine like effect, because you pose immunity yourself, which goes in preventing the recurrence of the same infection if it comes to you back. So yeah.
Okay, okay. Also, Doctor, help me understand that as far as the vaccination numbers in the country are concerned, um, do you think that that will really help us fight the new strain, considering there are many people in the country, about 12 crore of them, who've still not taken their second dose? And there are many countries in the world that have now started taking a third dose or a booster dose.
Certainly, I mean, this is a big challenge because country of our size with a huge population, despite government's best of the effort, we have done a miraculous job. I mean, it's a world record, to be honest. So, we need to further ramp up. India is distinguished in a way that we have got good number of companies which produce virus. We are one of the largest producer of the vaccines. So we can channel that and ramp up the vaccine as much as possible, because the data so far knows that regardless of mutations, this vaccine does help. It may not help you in catching the infection, but it will definitely help in preventing you from getting severe disease. And that's what we want to reduce. So first thing will be to make sure that the total number of complete vaccinated people, two vaccines, we should aim and ramp up. But then I agree that, remember, for instance, when I took a vaccine, that was in January. So I am now running 12 months down the line. So then we'll have to think about the frontline workers who who will be dealing with the COVID patients on these facilities, people who are more than 65, people having comorbidities. So these are the ones who got their vaccines in the first when the vaccination started. So I think we'll have to think about the booster dosing as well. And I think government is at the moment, that thought process is ongoing, and very soon I think we'll hear from them about the booster dosing. But the first thing will be to ramp up the second vaccination and try and get as much people to come forward and get them vaccinated first.
Yeah, that really would be very, very important given the fact that we have a new strain to fight with now. Also, I wanted to understand, say, people who have been infected with the Delta variant, is there any data to suggest that now they won't be infected by the new Omicron variant?
So no, as I said, there are some reinfection data coming in. And when I say reinfection in South Africa, means they had earlier been infected with COVID, most likely the Delta variant. So there are some data saying that people who had a Delta earlier are getting infected with Omicron. Having said that, they are not getting severe disease. That's the one thing so far we are seeing. I must caution though that these are early data. Things may change, but certainly there is a risk of reinfection with the new variant, even though someone has got a Delta variant before.
Okay. Okay. Also, let me ask you this question. It's also an important one for a lot of our viewers have been asking us. What is it that they can do to prevent themselves? Is it really going back to basics? Is it really wearing your masks and avoiding large gatherings?
Yes, I think Runjan, you are very right that regardless of whatever variation we see, whatever mutations we see, these Greek numbers are not going to say. Believe me, next 4 months there will be a new Greek word. So you watch this space for. But one thing is common among those words, regardless of which variation they carry, the mutation they carry, they always spread by air. So be it a droplet or aerosol. So the aerosol is a new addition to droplet, and they will continue to do so. So they're not going to be infected with bowels or eating or something. It is always going to be the. So if we heed to the proper basic COVID protocol, and which is wearing a mask, I think any mutant can't enter your nose if you're wearing mask. We know that. Uh, Washing hands, social distancing, avoiding indoor crowding, which we are doing, unfortunately, with the marriage season going on. I think I have myself got 5 or 6 cards recently in the last 1 month to come for a marriage. So, and that hall, remember, will be full of 200 odd people not
Yeah.
wearing masks. So these are the spreader events. So I think we people get complacent, and there is a what we call the pandemic fatigue. Remember, we have been going through this for the last 2 years. It's a human behavior. You want to break the shackles and come out and wander around like a independent creature. I mean, we have never been used to this, and this has happened. For somehow we have been doing it, and we want to break it. But my appeal will be, it's not over. We are still not. People have been saying about endemic. Please don't use the word endemic yet. We are not there. With the
Yeah.
new variant, it can again give you an epidemic like situation. So we are still in that pandemic on. We have
Yeah.
to hold our horses. We have to be a bit more we put down, don't do so much of a gathering, don't go to those things, and wear mask. If we try
Okay.
and do that, you can still protect yourself from infecting with Omicron.
Also, Dr. Arunesh, you clarified that when it comes to prevention of the new strains, such as the Omicron strain, it's basically the basics that we've learned
Hello.
in the beginning of the pandemic. Um, am I audible to you? Am I audible to you, sir? It seems like we've lost the audio with Dr. Arunesh Kumar. I
Hello,
was
can
going.
you hear me?
I can hear you. Can you hear me? So I think we have a bit of a problem connecting with the audio with Dr. Arunesh Kumar. But as he, in fact, has been pointing out that no matter which strain comes into the country or comes into the world, that is the nature of the virus. It is going to keep mutating, but what we can do as people, as responsible people amidst a pandemic, is to make sure that we follow
Hello.
all appropriate behavior. We wear our masks. We get vaccinated. Very, very important. Thank you very much for watching.